Hello, my name is Jennifer Ricky-Ram, and today I will be giving a presentation on how to become a registered nurse, and I, in the future, would like to become a registered nurse and work in the labor and delivery unit. To begin by explaining how to become a registered nurse, I would like to start by talking about the scope of practice. A registered nurse gives patients their needed medication, changes dressings, and keeps track of patient records altogether. Labor and delivery nurses specifically help mothers go through laboring and delivery process and the recovery process. Registered nurses are trained to watch over patients and to be in charge of files of paperwork and patient history and relaying this information to their assigned physician. Labor and delivery nurses are trained to watch over the mother and baby's vital signs, time contractions, administer medications and epidurals, aid in inducing labor, guide and comfort the mothers throughout the labor and delivery process, and make sure the mothers are comfortable and calm while helping them in any way. Nurses and many other medical professionals often work with a team. Registered nurses often work under their assigned physician and any other medical professionals involved with helping the patient go through their treatment process. Working as a labor and delivery nurse, you most likely will be working in a women's center or a labor and delivery wing. You will be working with the patient's entire medical team. You will assist the delivering doctor, the midwife, and anyone else involved in the process of labor and delivery. Registered nurses are very important when it comes to keeping track of the patient's treatment plans, complications, diagnosis, and medications. They keep track of all paperwork for the patient and help relay this information to the doctor and any other medical professionals involved with helping to treat the patient. Here I have listed some of the daily duties of a registered nurse in the labor and delivery unit. This can be shown by any actions or procedures that they do or follow throughout their daily routine. Within a work setting, registered nurses can work within hospitals, doctors' offices, and clinics. Working as a labor and delivery nurse, you will most likely be working in a women's or labor and delivery wing. Women's centers are commonly found in hospitals, and so are labor and delivery wings. You can be working with the patient's entire medical team, such as their physician, their midwife, or anyone involved in the process of the labor and delivery, and also the aftercare. Now, when first beginning to start the process of becoming an RN, you will first have to obtain your AA while majoring in a medical or science-related major. After receiving your AA, you can then apply for a 2-year Associates to Bachelor's RN program. Altogether, the process of receiving your AA and going through an Associates to Bachelor's RN program takes about 4 years altogether to receive your Bachelor's of Science in Nursing, or a BSN. Here I've provided some exam requirements for becoming an RN. Registered nurse programs help students prepare for the NCLEX RN exam. Students have 6 hours to answer 119 questions, and the passing rate for this exam is 70 through 75%. If students do not pass, they must wait 45 days before signing up to take the exam again. The NCLEX exam is the Registered Nursing Licensing Exam. Without passing this examination, you will not receive your license to perform as a registered nurse. In regards of licensing requirements, nursing students must first pass the NCLEX RN examination in order to gain their license as an RN. The Florida Board of Nursing's main task includes the licensing of nurses, which includes LPNs and RNs. The Florida Board of Nursing also is in charge of setting rules for licensing and practice within our state. All registered nurses go through clinical practice. Nurses must gain experience through units of interest. Practice and experience in units can involve learning from head nurses and physicians and can also involve job experience. or first-hand medical experience. Nurses can learn which unit they would like to go into or which type of practice they would like to work with while they're in nursing school, while going through different rotations while learning in nursing school. In regards of continuing learning or extending education, registered nurses with bachelor's degrees may attend school while working and continuing their education by working towards a master's degree. Many nurses go to school while they are working in order to extend their education. Nurses may also attend nurse practitioner programs to further their education and to also receive higher ranks throughout their workforce. After gaining years of experience within clinical practice, RNs may apply for these nursing practitioner programs. Now, as we begin to come to the end of my presentation, I would like to conclude by reviewing my timeline. Students can receive an AA within a science major, and this can take up to 2 years. After receiving their AA, they then can move on to a Bachelor's of Science in Nursing program. This program can take 15 months to 2 years and prepare students to take their NCLEX examination. After passing their NCLEX RN exam and becoming a registered nurse, they then can gain experience in clinical practice. It is suggested that these RNs gain experience for 2 years before applying to a nurse practitioner program. I would like to thank you today for listening to my presentation.